doctors. Yes, I'm Tumishi.
And I am Sipiwe.
I am Namasiku.
Yes, sorry for forgetting to introduce ourselves last time. So sorry for that. Yes,
we have
yes, we've rectified our mistake. Apologies.
Yes.
So today we'll be diving deeper into the topic of contraceptives.
Mm-hmm.
Yeah, we'll be talking about the barrier methods in more detail, the natural methods as well as the hormonal methods. So I'll go first, I guess.
Okay.
Yes. I'll be talking about the barrier methods. So what are barrier methods? These are methods that prevent the sperm from reaching the egg. Okay? Yes. So these can be things like the male condom, the female condom, which is less popular. We have other things such as the diaphragm, the cervical
What do you
cup,
mean
the
diaphragm?
sponge, and
What do you mean
we are
diaphragm?
diving deeper today, okay? I'm just listing them now. Don't be scared. Don't be scared of the names. Yes, I'm just listing them for today, for right now. Yeah, we'll talk about them a bit in more details. Yes. So those are some of the methods. So we promised to talk about how these methods fail. Today I will focus more on the male condom because it's more popular and for the sake of time as well. Yes, we don't want to lose our very faithful viewers in the course of talking about way too much. Yes, so we'll just limit our information to the necessary stuff. Okay. You know? Yes. So yes, talking about the male condom, we'll start with the failure rate according to the World Health Organization. So with correct use every time, the failure rate of condoms is about 2%. So 2% of couples, yes, will get pregnant while using the condom with correct use each time. But with typical use, which is the everyday use, there is a failure rate of about 15%. So 15% of couples will get pregnant while using the condom or can get pregnant while using the condom. So now, how does this happen? So what exactly is this incorrect use of condoms? How do they fail? So you have things like breakage. A condom can break. There's slippage where it slips out during the course of the act. I mean, it does happen where the condom remains inside the female's, anatomical genital tract. We'll say, yeah. And so it can slip out. It can be worn incorrectly. How? You're supposed to leave a small space at the tip of the condom for semen collection, but when that doesn't happen, well,
how do you know?
Fred, kind of. So yes, that can happen too. And doubling up on condoms, guys, don't do that. It's not the more the merrier or the more the better. It doesn't offer more protection when you wear double condoms. Just wear one. Wearing two is actually said to increase the rate of breakage of the condom. So don't do it. Don't do it. Yeah. So as well as looking at the expiration date of the condom, I know it's probably something that people rarely look at, but
honeybee.
Yeah, the honeybee scandals have clearly taught us a lot now. Yes, so look at the expiration date, guys. Yeah. It's very important as well.
It's necessary.
Yes, and incorrect withdrawal. Make sure that when you are withdrawing the condom from the female, it's intact. Everything is intact. It's put on well. It's not slipping out or anything like that.
Okay.
Yes.
Thank you very much. Right. Like I said, my name is Sipiwe, and I am doing the natural methods. Why are they called natural? It's because you don't have to. It's not a drug. It's not a. It's not. There's no medical use basically. It's just the natural way that things occur that you use to actually prevent pregnancy. Okay. So under the natural methods, we have 3. The first one is the calendar method. So this calendar method follows the pattern of your menstrual cycle. So it depends on whether you have a regular one or a regular menstrual cycle or an irregular one. Because if like you're one of those like, no, your periods come maybe this month, maybe they take like 35 days, the next month maybe they take like 26 days, then like guy,
an irregular cycle.
The calendar you won't manage. You won't manage. So the calendar one is good for people who have regular periods, regular menstrual cycle. That way they can actually track when they're ovulating. To ovulate, ovulation is just where the egg is released from the ovaries. And then, so
I was actually going to ask you, what is ovulation? It's a good thing you've said that.
Yeah, so that is ovulation, when the egg is released from the ovaries. So if you have a regular cycle, let's say for example, the normal average cycle takes about 28 days, right? So if you have a regular 28-day cycle, ovulation occurs on the 14th day. So 5 days before the 14th day and 5 days after the 14th day, that period is considered unsafe. It's the unsafe days. You can't don't risk it. Just don't. And then, but the other days, you're good to go.
Oh, so this is where the concept of safe days comes in.
Yeah.
People say, oh, I'm on my safe days.
Yeah, that's the concept.
Okay.
So the safe days are the days that are not in that 5 days before and 5 days after ovulation.
Okay.
Yeah.
Okay.
That's the calendar method. The problem with the calendar method, like I said, you need to have very regular menses.
Yes.
Otherwise, you're doomed, you know. But like I said, even last time, there are a lot of apps that can help you track. It's easy, guys. It's so easy. Then the second method is the cervical mucus changes that you can follow. So depending on which hormones are produced in different parts of the menstrual cycle, you will know when you're ovulating and when you're not and all that jazz. Okay? So
All the jazz.
it is jazz, Imwe. So yes, so for the cervical mucus changes, it depends on which hormones are being produced in that respective part of the menstrual cycle. So let's say it's estrogen, right? When you check the mucus down there, you know the mucus.
Down where?
So, there,
Mention the anatomical parts.
in your vagina. So if you check the mucus down there, if it's estrogen, the mucus is slippery, it's thin, it's smooth, then you know these are the safe days, you can do it. Then if you check your mucus down there and it's like thick, really, really thick, and it's like, you know, it's just it's not smooth and slippery like the other
It's
time.
actually quite stretchy as well.
It's quite stretchy?
Yeah, stretchy.
No, okay. Yeah, so you know all those properties, then you know, this is when I'm ovulating, this is progesterone at play. I ain't doing it. These are the unsafe days, okay? So around that days, like I said, even before, 5 days before, 5 days after, when you're ovulating, don't do it.
Don't do it. Don't risk it. It's not worth it.
Our third natural method is where you check your where you check your temperature throughout the month, okay? Throughout your menstrual cycle. So when it's time for ovulation, usually your temperature actually rises by like 0.2 or 0.5 degrees Celsius. So if your temperature is normally like at 36.5, all of a sudden, it's like at 37 or even 37.5. You're like, am I sick? Is it fever? You know, it's not. You're probably just ovulating, and that's progesterone. Then you know what? Don't do it.
Yeah.
It's not safe.
Just in addition to that, the temperature should be taken the moment you wake up, because I mean environmental factors can also change your temperature and all that. So the moment you wake up, check your temperature if you are using the temperature method.
Correct. Then I don't say it's the fourth one, but I just throwing it in. The other method is known as the withdrawal method. It's their favorite.
Pull out, favorite.
One day, but they get excited when they hear it. Pull out when. So it's also known as the pull-out method. It's also known as coitus what?
Interruptus.
Coitus interruptus. If you want to sound very scientific. But yeah, for this one, it's where you, when you're having intercourse, sexual intercourse, it's where you pull out the penis from the vagina, so that you do it before you ejaculate, so that you don't ejaculate in the vagina. The problem with this one is that there's what is known as pre-cum. This is the cum before the cum.
it's a fluid that is released before you ejaculate.
Correct. What she said. So in this pre-cum, sperms also exist and they can actually get you pregnant. So that's why it's not very, very safe. Statistics say that people who use the pull-out method, the withdrawal method, about 25% of them could actually get pregnant in the course of 1 year.
That's a lot of people.
That's a lot of
That's a lot of couples.
So if you want to risk it, do it. If not, don't do it.
It's not worth it.
It's not worth it. But yeah, so yeah, those are natural methods. I hope you learned something.
Hey! So I'll talk about hormones that are used to prevent you from getting pregnant. So normally your body produces these hormones, but then they come in three forms. They come as IUDs, implants, and in form of pills, are mainly focused on
Implants.
IUDs. What are those?
Implants means the gate to put it in your body, and then the hormone is secreted from there.
Oh.
An IUD means it is a small device is placed in your body, and then the device secretes the hormone.
Oh, then that's put inside your uterus.
Oh.
Yeah.
Oh, we mentioned that in the previous video. You should
Do
go
check
it
out.
So for the pills, we have got combination pills and progestin only pills. So for the combination pills, we have got the estrogen and progesterone, which are the main hormones that are in charge of the menstrual cycle.
Okay.
And for the progestin only pills, like they say, progestin only pills, there's only one hormone in there. So for the combination pills, they maintain the levels of your normal hormones that are in your body to prevent you from getting pregnant. And for the progestin only pill, it makes sure the favorable environment for you to get pregnant is not created. By the favorable environment, I mean the mucus becomes thick so that the sperm doesn't penetrate.
It won't swim when I'm imagine, okay guys, you have water and then you have yogurt. Where do you think the sperm will pass?
Water.
In the water.
I mean, even blood is thicker than water. What more?
What more?
Yeah. So the other thing that the progestin does is that it makes your uterine wall or your womb so thin so that in case fertilization occurs, implantation won't take place. And then
Implantation. What's that?
implantation
Shanga means
What are we planting?
implantation meaning the baby won't go like where the baby is supposed to be in the womb. That environment won't be ready for it to
like when
go.
the egg has been fertilized, it
It
goes
won't
to
attach.
the uterus in the
Yes.
womb.
Yeah.
Then it doesn't attach to the womb.
Yeah,
Oh.
when it is to the wall, meaning you get pregnant, but it will be no attachment.
It's late, Buddha. It's late.
Yeah, so it gets flushed out in the next menstrual cycle.
Okay.
So for progestin only pills, it's advisable that you take them at the same time every day. Let's say if you're taking them at 19 today, make sure it's 19 every day. Yeah.
You
Very
people.
important.
And also being female is wild.
So for both progestin and combination, you have to make sure you take them at the same time every day.
That's the reason they
and then
probably
if
tell
you
maybe.
are-
Because like guys, okay, personally, like even when I just have a flu, hey, and I'm given medication to take, like, oh no, antibiotics for example, I do not take at this time every day. Nima can give a guys. I'll remember like 2 hours later, 3 hours later. So like what's the gap? What's the window? What's the time period that you're supposed to take them in case you actually forget?
So in case you actually forget, you're supposed to make sure you take them within 12 hours. That's in case you
Not
actually
bad.
forget. Yeah, and that's the reason why some people get pregnant because of forgetting.
Okay.
So both combination and progestin only pills are 99% effective if you take time.
Okay.
What are the odds that you're in the 1%,
That's a
guys?
very good
If you
percentage.
don't keep your time, if you skip and all that, they are 92% effective.
So if you're like, you know, if you take them like typical use basically, like you know, you can't be 100% perfect all the time. Like
Yeah.
Yeah.
19 hours, 19 hours, like maybe 1905, 1930, you know, but it's at 19. Yeah.
Or you have something going on that day, you
Yeah.
happen to forget your pills, then
they are 19, you said 92?
92%?
92% if it's typical.
Okay.
So make sure you take them on time to attain the 99%.
Okay.
But you can also find the 1%.
It can still be you.
It's not 100%.
So don't forget to share, like, and follow us on all the platforms, that is YouTube, Facebook, Instagram, and TikTok.
Yes, and also, guys, these videos are not meant to substitute professional medical advice. If you have any questions concerning fertility, concerning contraceptions, concerning anything medical, really, do visit your nearest healthcare provider, and they'll give you the correct advice for whatever it is that you want to know. This is just for educational purposes. Like we always say, we don't want you clueless.
So clearly, after watching this video, we have seen that condom knowledge is not common
Or just
knowledge.
contraception knowledge generally,
In
guys.
general.
Yeah.
So yes. So what happens if you miss your pill, if you're on the pill, or you happen to have an unprotected sexual encounter? What do you do? Like, oh my gosh, what happens next? So catch us on the next video when we'll be talking about the emergency contraceptive pill, guys. Don't miss out. We
Now
got
have
you.
more options.
Yes. Yeah.
Until next time, bye bye.
Bye.